everyone is safe and sound. Myself, Dr. Surya, and I will be discussing the recent Kerala University of Health Science Periodontology question papers. As we all know, perio is a very vast subject, and hence all the questions cannot be discussed in one section. So I have divided this question paper discussion session into 4 to 5 parts. So today I'll be discussing questions from 6 chapters, and for each question I have added references also. I hope this is really helpful for you guys. If you have any doubt or query, please do clear them in the comment section. Before commencing, I would like to thank Dr. Zahir for giving me this wonderful opportunity. So coming to the first chapter, that is biology of periodontal tissues. Now, if you guys have observed any university question paper from perio, there will be definitely one question from the normal periodontium. That is at least one question from either gingiva, periodontal ligament, alveolar bone or cementum. Okay, so you have to be thorough with these 4 chapters. Coming to the first question, what is dentogingival unit, and discuss about the junctional epithelium and add a note on its development. So this is a direct question from chapter 1, gingiva in Carranza. I have even added the page number for your references and convenience. So coming to the contents of this answer. So first part, that is what is dentogingival unit. It is nothing but the gingival fibers and the junctional epithelium, they together form the dentogingival unit. Coming to the second part of the question, discuss about the junctional epithelium. So in this section you have to add about what is junctional epithelium, what it consists of, what are the layers, what are the structure, what are the zones, and what is the function of the junctional epithelium. So what is consist of is nothing but the stratified squamous non-keratinized epithelium, and then you have to write about how many cells wide it is present at the coronal aspect and the apical end, and then what is the length of the junctional epithelium. Then coming to the structure of junctional epithelium, in the structure you have to write how the junctional epithelium is attached to the tooth, that is via the internal basal lamina, and how it is attached to connective tissue, that is with the help of the external basal lamina. Then coming to the zones of junctional epithelium, there are 3 main zones. It is given in Carranza, and the uses has also been mentioned. Then coming to the functions of junctional epithelium. So functions, there are 3 main functions that is written in Carranza, and all the 3 should be mentioned. It is very important. Now coming to the development of junctional epithelium, the answer for this question comes under the heading development of gingival sulcus, which is also given in chapter 1 gingiva. Okay, so in short I will just try to explain the development of junctional epithelium. It is nothing but the confluence of oral epithelium and reduced enamel epithelium during the tooth eruption. Now coming to the second question, that is what is periodontium, discuss in detail about anatomical and histologic features of healthy gingiva. This is also a straight cut question from the first chapter gingiva. The first page itself they have mentioned what is periodontium. So first you have to write the definition of the periodontium and also mention the 4 components, that is gingiva, periodontal ligament, cementum and alveolar bone. Then coming to the second part of the question, that is discuss in detail about anatomical and histologic features of healthy gingiva. So before you start about this question, first just mention what is gingiva and then come to the anatomical features. Now anatomical features are nothing but the macroscopic features of gingiva, which includes the 3 parts: marginal gingiva, attached gingiva and interdental gingiva. Along with this, please do mention about the gingival sulcus also. Now coming to the second part, that is the histologic features. In histologic features is nothing but the microscopic features of the gingiva. So in this question, in this part of the question, you have to add about the various layers of the stratified squamous epithelium, that is the stratum, corneum, basal, etc. You have to write in this part. And then once you have mentioned about the 4 layers of the stratified squamous epithelium, then you have to mention about the gingival epithelium. And under gingival epithelium, add a note on oral epithelium, junctional epithelium and circular epithelium. And after that, write about the gingival connective tissue, then about the gingival fibers, and also mention about the dentogingival unit. Coming to the next question, that is the short essays. So short essays, they carry like 5 marks each. So you have to write a bit in detail, but not as long as a long essay. So coming to the first question, structure and functions of cementum. This you have to refer chapter 2, tooth supporting structures in Carranza. The page number has also been mentioned. So under this question you have to write, first mention what is cementum, then the types of cementum and Schroeder's classification. The diagrams are needed. Under the types of cementum, you have to show where the radical cementum is present and where the coronal cementum is present. And also the Schroeder's classification, the types of cementum. If you draw a diagram mentioning all the different types of cementum, you will fetch more marks. And then coming to the functions of cementum, the 5 functions I have mentioned here. That is, the cementum helps in tooth support. It maintains the integrity of the root and its position. It provides attachment to collagen fibers. It helps in repair and regeneration. And since cementum is harder than bone and it is avascular, it does not undergo resorption under any sort of masticatory or orthodontic force. Now coming to the next short essay, that is classify cementum, describe about structure and function of various types of cementum. It's already discussed. So I'm moving over to the next question. Describe the structure and function of periodontal ligament. So this also you have to refer the periodontal ligament chapter 2, that is the tooth supporting structure. And what all contents you have to write is, first define periodontal ligament, write the structural components. Under the structural components, write about the cellular elements and the principal periodontal fibers. And coming to the function, the first function is the physical function. So under the physical function, do write about the resistance to impact of occlusal forces. Mention the 2 theories, the tensional theory and the viscoelastic theory. And then write about the transmission of occlusal force to the bone. So into this you have to write what happens when an axial force is applied and what happens when the horizontal or tipping force is applied to the bone. Okay, so that comes under the physical function. Then write about the formative and the remodeling function. In the remodeling function, please do write about the turnover rate of the periodontal ligament. Then coming to the nutritive and the sensory function. Draw the necessary diagrams. Please do draw the periodontal ligament fibers diagram. That is more important. Now coming to next one, that is describe the structure of junctional epithelium. That is already discussed. Then next question is describe the microscopic details of gingiva and classify the gingival bleeding. So the microscopic details of gingiva I have already discussed. So in the microscopic features, you have to write about the oral junctional circular and also about the gingival connective tissue fibers, mention about the dentogingival unit. Then coming to the classification of gingival bleeding, you have to refer chapter 13, clinical features of gingivitis in Carranza. Now coming to short notes, first question, anatomy of alveolar bone. So for this, refer chapter 2, tooth supporting structure in Carranza, page 28. So under this question you have to write, first define the alveolar bone and write the parts of the alveolar bone with the diagram. Next question, principal fibers of periodontal ligament. So in this you have to mention about the 6 principal fibers of the periodontal ligament. So before that, do mention about what is periodontal ligament and then the structural components, and then describe in detail about the periodontal fibers, and please do draw the diagrams. Now coming to the next question, cells in the periodontal ligament. Here also, first define periodontal ligament, then write the structural components, two types, cellular elements and periodontal fibers, and then write in detail about the cellular elements. Please do the diagram. The next few questions I have already discussed, that is the classification of cementum. You have to write the Schroeder's classification as well as the other classification, that is the cellular, and also the coronal and the radicular cementum. Then dentogingival unit of is also mentioned, also discussed already. Then gingival fibers is also mentioned. You have to do a diagram for the gingival fibers. Then coming to the next, that is the clinical significance of attached gingiva. Refer chapter 1, gingiva. Under that, the macroscopic features, the attached gingiva will be there. Draw the diagram for the attached gingiva. Label where the attached gingiva is, where the mucogingival, and where is the alveolar mucosa. Now coming to the second chapter, that is the dental plaque. So the long essay, first one is describe dental plaque as a biofilm and add a note on steps of dental plaque formation. You have to refer chapter 8, biofilm and the periodontal microbiology in Cavenza, page number 99. So the contents coming for this answer is, first you have to define dental plaque. Preferably please use the definition given by WHO. So once you have defined dental plaque, define what is biofilm and then write about the structure of dental plaque. If possible, classify the dental plaque, that is the supragingival and the subgingival dental plaque. And structure of dental plaque is nothing but how it looks microscopically, the supragingival as well as the subgingival dental plaque. Then coming to the formation of dental plaque, the three main steps has to be mentioned, that is the formation of the pellicle, initial adhesion, colonization and maturation. Coming to the second question, define dental plaque. Again, it's already discussed. Describe in detail about the mechanism of plaque formation. You have to write the 3 steps and then different plaque hypothesis. Okay, so coming to this plaque hypothesis, you have to mention the 4 main plaque hypothesis, that is the specific and the non-specific plaque hypothesis, the ecological plaque hypothesis, it has a diagram, and also then the recent one, that is the keystone plaque hypothesis. Please don't forget to mention the latest plaque hypothesis, that is the keystone plaque hypothesis, and draw the necessary diagrams. Now coming to the short essays, the first question is already discussed, define and classify dental plaque and what are the various plaque hypotheses. Then next question is classification of chemical plaque agents. Okay, so when you write this question, first define what is dental plaque and then write about the plaque agents. So there are 2 types of plaque agents, that is first is the chemical plaque agents and then the mechanical plaque agents. Mechanical plaque agents is nothing but our toothbrush, toothpaste, interdental aids, etc. And then about the chemical plaque agents, which you have to refer chapter 35, plaque biofilm control in Cavenza. Coming to the short notes, stages of plaque formation, you have to write the 3 stages, formation of pellicle, initial adhesion, and third one is colonization and maturation. So the 3 steps you have to, stages you have to write in this particular question. Now coming to the second one, that is the ecological plaque hypothesis. So when you're writing this answer for this question, first define what is plaque, then write the 4 hypotheses and then write about the ecological plaque hypothesis. There is a diagram also for this plaque hypothesis. Please do draw that. Now coming to the structure of biofilm, that is already discussed. Now coming to the next question, that is the Sokrinsky criteria for periodontal pathogenesis. So this, because this was not there in the Cavenza, I have written it. So Sigmund Socrates, he was a researcher at the Forsyth Dental Center in Boston, and he had modified the postulates. So according to him, there are 5 postulates. That is, first is the association of the lesion, second is the elimination of the suspected organism, third is the host response to the organism, fourth is animal studies, and fifth is the virulence factors. So these 5 criteria you have to write under this question. Coming to the third chapter, that is calculus and other etiological factors. So the long essay, describe the role of iatrogenic factors in the etiology of periodontal disease. This is a straight cut answer from chapter 10, the role of dental calculus and other predisposing factors. So here the iatrogenic factors for you to include are the contours and the open contacts, the margins of the restoration, the materials that is used for restoration, that is for the cap, the acrylic. Sometimes as a temporary cap they give the acrylic cap. So in acrylic cap what happens is there will be plaque accumulation. So those are the iatrogenic factors. And also design of RPD, FPD, the restorative procedures like the use of rubber dam clamp, matrix band, etc. They can lacerate the gums. So they come under the iatrogenic factors of in the etiology of periodontal disease. So please refer chapter 10. Next is the short essays from this chapter. First is the differentiate between supragingival and subgingival calculus. So there is a table that is given in Carenza for this question. So please do refer that table. So, but that is a very short for a short essay. So that's why you have to add add to the bulk of this question. So that is, first you have to define the calculus, then classify the calculus, and then write that table. So that will fetch you 5 marks. Now next question is explain the mineralization of calculus. So for this you have to refer chapter 10, role of dental calculus and predisposing factors, page number 121. So again, coming to the content of this question is first define calculus, classify calculus, and then write about the formation and mention the theories. Just mention the theories, no need to explain it. Now coming to the next question, that is theories of calculus formation. So for this question, please define calculus first, then classify the calculus and write about the theories. Then coming to the next, that is short note, bruxism. Okay, so because short notes are like 3 marks, you don't have to write this much sentences. Just write what is bruxism, and then just mention about the etiology and the symptoms, and please do mention about the consequence of bruxism on periodontium. I've written it in the point wise. So all these points is needed for this question. And treatment, if you want, you can write. Okay, so for 3 marks, please don't forget to mention the consequence of bruxism on periodontium. Next one is management of cervical dental hypersensitivity. So first you have to define what is dental hypersensitivity, and then how it is characterized, and then mention about the management, that is the treatment approaches. So I have written it here under 3 headings. First is the patient counseling, second is the interventional treatment, and third one is the blocking the neural transmission of the pulp. Next one is role of genetics in periodontal disease etiology. So here also the answer for this question is towards the end of chapter 10, the role of dental calculus and other predisposing factors. So first write first give a little bit introduction, okay, and then write about the studies. That is, there are a few studies that has been given, that is the familial study, segregational study, linkage study, twin study, and all. And then also do mention about the role of genetics in aggressive periodontitis. coming to next question, that is food impaction. So for that, refer chapter 10, role of dental calculus and predisposing factors, and then also refer chapter 19, that is the bone loss and patterns of bone destruction, page number 125. So in this chapter 10, it comes under the iatrogenic factors, that is the contours and the open contacts. In that they have mentioned about the food impaction, and also please don't forget to mention about the plunger cusp. Iatrogenic, next question is iatrogenic factors, which is already discussed. Now causes and sequelae of food impaction, again refer the chapter 10 and chapter 19. The sequelae of food impaction I have mentioned here, this point in point wise, please do refer this. Now coming to the classification and epidemiology of periodontal disease. So the first question is classify periodontitis and then discuss the etiology, clinical features, radiographic features of aggressive periodontitis and anatomical management. It's a very lengthy answer, so time management is important for this question. So classify periodontitis, that is, for this you have to refer the classification chapter in Carranza, and then you have, for the second part of this question, that is on aggressive periodontitis, refer the chapter 22, aggressive periodontitis, and whereas for the management, refer management of aggressive periodontitis, chapter 31. Coming to short notes, that is the gingival index is a most commonly asked question. So for this you have to refer chapter 6, epidemiology of gingival and periodontal disease. First mention what is index and then write about the gingival index. Also write about the scores and the interpretation for the gingival index. And coming to oral malodor. So the most commonly asked question is halitosis and etiology of malodor. They will ask usually as a short note or a short essay. Okay, so halitosis and etiology of malodor, you have to refer chapter 41, breath malodor. So for halitosis, you have to first define halitosis, write the etiology, write how we can diagnose malodor, and write the treatment part. Etiology of malodor, refer the chapter. There are local as well as the systemic causes. So please refer this chapter. Coming to the next chapter, that is smoking and periodontal disease. So the first is the long essay. So describe the difference between risk and etiologic factor. Enumerate various risk factors associated with the periodontal disease and describe in detail the smoking. Okay. So for this, you have to refer chapter 27, clinical risk assessment in Carranza, page number 299. For the first part of the question, you have to refer chapter 27. So in that chapter they have described what is risk factor and what all comes under the risk factor. That is the second part of the question. Also for that also you can find answer in this chapter 27. And for the third part of question, describe in detail the smoking as a risk factor, you have to refer chapter 9, smoking and periodontal disease. Now in this chapter 27 they have not mentioned about the etiologic factor, so I have just mentioned here it. So what are etiologic factors? They are nothing but factors that directly initiate the disease process, and they are considered as necessary condition for the development of disease. For the risk factor, you refer this particular chapter. So that's all for today. We'll get back to you with the next few question answer sections from another set of new chapters. Okay, thank you.